If you are an overseas nurse hoping to join the UK NMC register for you to be able to practice in the UK, then stay with me as I walk you through the step-by-step process on how internationally trained nurses and midwives will be able to join the UK NMC register. The first and most important thing that you need to know is that for you to be able to join the UK NMC register as an internationally trained nurse, you need to be someone who has gotten the education and has gotten the training as a nurse in their home country. So if you do not currently have a training in nursing or midwifery or mental health nursing or learning disability nursing, then unfortunately this step-by-step process is not meant for you. This is for only those who have been trained in their home countries and probably they have gotten their PIN, their home country's NMC PIN, and they may have practiced for maybe some time, but it doesn't matter. You should be someone who has been trained in your home country. You have the skills, you have the knowledge, and then you have the certificate to prove that indeed you are a registered nurse, a midwife, a mental health nurse, or a learning disability nurse. The next thing to do will be to identify what role that your current certificate will allow you to occupy when you join the UK NMC register. So unlike your home country, if you're a registered general nurse, you are going to join the UK NMC as adult nurse. Now, for those who have certificates in community health nursing, or those who have certificates in nursing assistant clinicals, or those who are enrolled nurses, you are going to join the UK NMC register as nursing associates. And so when you are going through your registration process, don't forget that you are going to occupy the position of a nursing associate. Now for midwifery, if you have a diploma or a degree in midwifery, you are going to join as a registered midwife. The same for mental health nursing. Once you have been able to identify the role that you are going to occupy, the next thing that you need to do is to create an account with the UK NMC. And how do you do that? You need to first go to the official website of the UK NMC, which is nmc.org. That is the official website of the UK NMC. Once you find yourself on this website, just head over to registration and then they will ask you a series of questions and then you can go ahead and create an account with the UK NMC. There's going to be a separate video that takes you through the step-by-step on how to create an account. So don't forget to visit this page again to find out how to create your UK NMC account. So after you've created your account, the UK NMC is going to request some documents from you. And one of those documents is going to be your education certificate and then details of your PIN, your registration PIN from your home country. And then I believe some details of your passport, your international passport. Once you have uploaded all this information, they will have to do their background checks. They will have to go through and check if your current certificate and training meet their standards. You're going to receive an email telling you that they've gone through your certificate and you need to move on to the next stage of your registration process, which is for you to initiate foreign verification, which is the third point. Foreign verification simply means that inform your home country that you are interested in joining the UK NMC register. Therefore, they should give you the go-ahead, or they should be able to testify to the UK NMC that indeed you have been trained as a nurse, a midwife, mental health nurse, learning disability nurse in that country, and you have the necessary skills and knowledge to be able to practice to the standard that the UK NMC requires. On your NMC portal, after you've created your account, you're going to see a section that they've labeled foreign verification. You will click on that and they will ask you to select your home country's NMC regulator, which is going to be, example, NMC Ghana, NMC Nigeria, or Gambia NMC. Once you select that, the UK NMC will have to make contact with your home country's NMC, and then they are just going to ask the details that I mentioned. That is this person from this country? Has this person been trained? And has this person got the knowledge and skills to be able to perform to the standard in the UK? So once the NMC from your home country receives this request and information, they will have to now confirm to the UK NMC that yes, this person is on our register, this person has been trained, this person has got the skills and will be able to practice if you allow or if you give them opportunity for them to join your register. On foreign verification, this is specifically for those from Ghana. If you currently hold a diploma, then you would need to also initiate what is termed as the Ministry of Health clearance, MOH clearance. This Ministry of Health clearance needs to be processed before your foreign verification can be confirmed by NMC Ghana. And so if you hold a diploma, make sure that you go through the Ministry of Health clearance before you initiate the foreign verification. If not, then your foreign verification may delay for a very long time. For those who have got degree and those who are joining the UK NMC register as nursing associates, as at the time that I am recording this video, you are not expected to go through the Ministry of Health clearance. After the foreign verification has been processed, you are going to receive an email from the UK NMC. That is the fourth point. And the email is going to tell you that we've heard back from your home country's NMC, and you need to prepare for these two exams. Together, they call it the test of competence. One of them is the CBT, and the other is the OSCE. For the CBT, they would like to know how well you understand drug calculations and how to prepare medications to be able to administer to your patients. So you may get several types of numeracy questions, including calculate the required dosage for this medication if your patient has got these details, or maybe complete a fluid balance chart. So if you are joining as a midwife, you're going to have CBT specific questions. Nursing associate, you're going to have CBT specific questions, same as adult nurse, and then the rest. The CBT has got two parts. The part A is called the numeracy, the one I've just explained. The part B is the clinical or the theory part. That one has got objective questions that is being asked around every aspect of your practice. So you need to prepare to answer at least 100 questions, and you are going to have 2.5 hours to be able to answer those 100 questions. And you need to pass both the numeracy and then the theory part of your CBT to be able to move on with the rest of your registration process. For OSCE, which is the other test of competence, the full meaning is objective structured clinical examination. And this is where you need to perform a clinical skill for an assessor to confirm that you can practice safely. The OSCE is made up of 10 stations, and you need to pass all these 10 stations or tasks. There's going to be separate videos where I will explain into detail the CBT and OSCE for you to know how to prepare and then what kind of questions you should anticipate for these two exams. One thing that you need to also know is that these test of competence exam, the CBT and the OSCE, you have 3 attempts for each one of them. So for CBT, you have your third attempt to ensure that you've passed both the numeracy and then the theory. For the OSCE, you have 3 attempts to ensure that you pass all the 10 stations. Now, after you've gone through these tests of competence, you need to also prove your English proficiency, which is the next point. Your English proficiency is only going to be accepted if you have written either IELTS, OET, or if you can provide an information from an employer, which is now called the SIFE. But it has got some requirements that you need to meet, and this is for only those who have currently been in the UK and they've practiced in a health and care setting for the past 12 months. So for those, they will be able to have a conversation with their employer. If their employer agrees to provide this information to the UK NMC, then the UK NMC will accept that in place of either the IELTS or the OET, which is the required English proficiency test that the UK NMC accepts. There's going to be another video as I explain to you what SIFE is about and all the requirements that you need before you can use the SIFE as your English proficiency. Now, the last thing that you need to do as part of this registration process for you to be able to join the UK NMC register is to do ID checks. ID checks is where you need to present physical copies of all the documents you have uploaded onto your NMC portal for the ID officer to have a look physically. This can be done on the day that you are doing your OSCE, or you can book another time if all the documents that you need is not ready at that time. Once everything has been processed and once your ID checks have been completed and you finish with the earlier steps that we've discussed, your PIN is going to be processed and you're going to receive an email that you have successfully joined the UK NMC register. This is the step-by-step process on how to join the UK NMC register. Stay tuned and come back to this page as I detail every information you need to know as an overseas nurse, midwife, mental health nurse who is willing to join the UK NMC register for you to be able to practice in the UK. Don't forget to leave some few likes, subscribe, and follow this page for more. See you in the next one.